Medical care should not be a fight between the patient and the medical team. Medical care is communication, and medical care is teamwork. And when it comes to rare diagnosis, it is okay to say, and I will sit down a little bit, let me refer you to someone else. I will discuss this with a colleague, or this out of my comfort zone. I found this chair a little bit out of my comfort zone, so I will not sit on that one. It is okay to say, this is out of my comfort zone, but I will find out. I am Elizabeth Tornland, and I am a health educator and athletic trainer. I am also a classical Pilates teacher, and I also recently had back surgery. There my mishap with this chair. But I'm here today to speak as a patient, because I recently was diagnosed with Ehlers-Danlos syndrome. Let me see if this one works for me. There we go. So, the Ehlers-Danlos syndrome are a group of connective tissue disorders. They can be inherited or they can be mutated, and as for me, I do not know. They are different in how they manifest in the body, but they're also different in the cause. Often we are hypermobile, so we can stretch beyond the range of normal. And I often get the question to show off, to lift my foot above my head. And I will not do that, because that would cause me pain, and I prefer to stay out of pain. Our skin can also be affected, so we have a smoother skin. It can be hyperextensible. Mine is very smooth. We are often younger looking than we are, so I'm standing here at the age of 52. The connective tissues, they are the materials in the body that binds together, that protects and strengthens the body. It is found in between other tissues, and they're providing strength and stability, and helps perform general functions as well as specialized. The connective tissue disorders disrupt fundamental processes and structures. So resulting problems can be widespread, and often they affect areas that might not seem to be related. Now, the Ehlers-Danlos syndrome is rare. Therefore, the zebra is a medical mystery, is a medical zebra. Now, I found a picture. Let me see if I have better luck. Yes. So this is a good picture of my body reversed to someone without the Ehlers-Danlos. So this is your body, and here is my body with Ehlers-Danlos. So my body can be a big surprise for me, how it will respond or how it will act. I wanted to sit on a chair, and my body said, no, we're not going to help you do that. It's, what should I say? Well, let me go to chronic pain. Because as a chronic pain patient, we are often misunderstood, or we have the feeling of being misunderstood. We're feeling frustration, we're feeling fear, or even despair. And the communication with the caregiver, with the health professional, is lacking. We end up in a negative communication or lack of communication. Now, living exposed to prolonged pain increases the risk of depression and anxiety. Now, who does not get anxiety when in severe pain? But the pain is not the problem. The anxiety is. So, fix the pain first. I recently heard from a doctor that my behavior was not normal I was in severe and bad pain, and my behavior was not normal. And that kind of made me wonder what the expected normal behavior would be under a normal circumstance. And isn't it a proof in itself that something is wrong when the behavior is not normal? But to live through that level of pain and that feeling of total collapse, it can bring out the darkest thoughts. I can guarantee you that. But what I have found is that I find a lot of strength in the kindness of people around me. So if you can't do anything else, be kind. So my story is that I have always battled with severe pain, dislocated joints and hypermobility. But I began studying Russian ballet when I was very young, and I pursued a dance career. So this was normal for me. Hypermobility was normal. And I found strategies to deal with that. It helped me with my dance career, my dance education, and it also triggered me to go on a Pilates quest. And I had the privilege to study with some excellent Pilates teachers, international, that were very familiar with the authentic method of Pilates. And the purity of that method is rehabilitation. For me, I remember my skeleton. For me to go into the Pilates studio, to work on the Pilates apparatus, and for you who are familiar with Pilates apparatus and the machines, we have springs, and they are lubrication, and they are a joy to my soul, or to my body, and to my joints, and also to my soul. I get very happy from working out. But let me take you back to medicine. Honestly, it scares me when medicine becomes a lottery. A lottery, as to say, how will my body react this time? How will the doctor respond? How will the nurses treat me? How will they understand, or will they at least know that they don't understand? So you see the problem. I've had my share of hospital experiences, and I had major surgeries. I had a neck stabilization, and I had surgery in my lumbar spine just a few weeks ago. That's why I'm a little shaky on my legs at this time. And they were a success. But being in a hospital, there are often also mishaps. And let me give you 2 examples of that. And one being, I have been given muscle relaxant. And I depend on muscular stability, if you look at the fine X-ray of my spine here behind me. Okay, so what happens when I get muscle relaxant is that the pain increases. And I lose function. I lose function in my legs, I lose function in my arms and my hands. I can't move. And of course, that's not the intent with the medication. And here's a trick and you will face with the Ehlers-Danlos syndrome. We don't react to pain medication or painkillers the same way as others. Which leads me to my other example. Morphine. So if I come into the hospital with high level of pain, I'm usually given morphine as painkillers. And I get a high like 15, 20 minutes, and then it's nothing. There is no pain reduced. So I'm crying out of pain, and there is no relief. So how many times have I not been accused of just wanting the meds, or being a drama queen, or attention junkie? And I certainly do hope I'm none of those. And I will put a hand on the table for security of my legs. You know, someone said to me, it's not the patient's fault if the pain cycle can't be broken. As a patient, you're very dependent upon the medical team, and we are vulnerable. So what has to change is how we see people. Being in a dialogue and not a monologue. Medicine being a teamwork, with the patient as an essential team member. Communication. You know, it's okay not to know everything. As a patient, I do not need my doctor to know it all or to be almighty. But what I do need is to feel safe and listened to. And my own doctor, she usually says, it's okay, hang on, we got you. And that means a world of a difference to me. The somatic issues and the psychological issues are connected. I do believe we need to change to more holistic thinking. I also believe that we need to work together as a team to communicate, teamwork, and also to include the patient in the teamwork. And I thank you for your attention. Thank you.